Hip replacement is another procedure that I do very commonly, and hip replacement really is putting a new titanium shell up into the pelvis. There's a piece of polyethylene that goes into that titanium shell, and then we replace the femoral head as well. So the ball, there's a stem that goes down in the femur, and a new ball that goes onto that stem. And then when we put that all back together, the patient doesn't have a bone-on-bone hip anymore. They have a new replaced hip. One of the things that I like to do is called anterior hip replacement, and anterior hip replacement has come about over the last 10 years or so. All that means is it's a different way to get to the hip. So there are different approaches to the hip. There's posterior approaches and anterior approaches. All approaches can be useful in certain situations. Anterior hip is specifically interesting to me because it's an approach that really is muscle sparing, so that when we're getting inside the hip, we're not detaching any muscles, and it tends to result in quicker patient recovery, lower risks of dislocation, and I think higher satisfaction for our patients. One of the things I really love about anterior hip replacement is that we do that procedure on a special table with the patient supine, so they're lying on their back. And that seems like a small point, but posterior approaches are done with the patient lying on their side. And if you think about what happens to a patient's pelvis when they lie on their side, the pelvis starts to oblique and isn't lying flat anymore, so it makes it very difficult to get intraoperative x-rays. When we're doing anterior hip replacement, we can use a live x-ray over the patient, and we can really get a perfect x-ray every single time. So one of the things I really love about anterior hip replacement is the ability to check my work before we finish doing that procedure. So I find that there are really no surprises with anterior hip replacement in the office anymore. Those implants come out perfect every time, because if they didn't, we would change them while we were there.